Well, good afternoon and welcome all community pharmacies. This is the mini community pharmacy more profit roundtable. I'll be your host. My name is Breck Rice. I've been helping community pharmacies now for more than 2 decades. So it's been about 22 years now. Absolutely love the industry. Will do everything I can to help you be profitable. And that's why I put on this podcast series. This is the mini version. We'll only spend about 20, 25 minutes this afternoon. The full hour long version is the More Profit Roundtable that is only once a month on the second Wednesday of each month, noon Eastern Time. And I'll provide a link in the show notes for anyone that wants to attend that. So I have been, like I said, helping community pharmacies any way that I can. One of the ways is that I host the PBM Reform podcast on the Pharmacy Podcast Network. Try to chisel away at that mountain of the PBM and insurance mafia and make a little progress here and there any way we can to try to make positive changes. Because that is a very slow process, that's the other reason why we do the more profit roundtable to identify solutions that will bypass the PBMs to help bring more profitability to your community pharmacy. Now, on the podcast series, I've been a firm believer that you should have about 1/3 of your revenue coming from non dispensing. But as you can see by this chart here, independently owned pharmacies are not quite there yet. And so I wanted to provide some solutions that will help you do that. And so many community pharmacies are interested in expanding their scope of services into doing other things. But I would be remiss if I didn't tell you about our program, the ServeRx program, which is absolutely free to all community pharmacies. In fact, you're probably already contracted with us through your PSAO. This is the first step in bypassing the PBMs in order to get the fair reimbursements you deserve. As this slide states, that one of the biggest risks to community pharmacy is continuing to do what you've always done. That's the status quo. Just keep just dispensing medication and losing profits on those medications that are being dispensed. So as you can see by this chart, we help you get a fair reimbursement and get the higher reimbursement that you deserve. So medication like meloxicam, the PBMs are only wanting to pay you $4 and $5. You should be earning over $90 reimbursement on that one medication alone. So there's a chart of some other commonly prescribed medications. So we're here to help you. Again, it's a free service that is provided by your PSAO. If you're not yet using ServerX or BIN, and PCN, please reach out to us and we'll get you set up so that you can get those higher reimbursements that you deserve. Now, I have outlined a three-step process because so many community pharmacies are also interested in expanding their scope of services into clinical services. And it starts with step one, which is remote therapeutic monitoring. So I'm going to share with you in the next few minutes here a program that, again, is completely free to your pharmacy to set this program up. It is the first time that a platform like this will be offered through community pharmacies. So that's a pretty exciting opportunity. Most remote care programs were designed for the physicians to offer to their patients. This Brain Health Plus will actually be a platform that pharmacies can offer this program to their patients. So pretty exciting. Step two is really expanding your scope of services into doing more medical billing for clinical services like annual well care visits or continuous glucose monitoring. Today, community pharmacies are giving away services for free just out of the kindness of your heart. You're helping patients get set up with their glucose monitor, showing them how to get their readings. Well, and under step two, the independent pharmacy provider network, you'll actually get compensated for that. And I'll talk to you more about that a little later on in the program. Step three isn't for every community pharmacy. You've got to have space for it. It is a full brick and mortar clinical room. Footprint needed is probably about a 10 by 12 footprint, 10 by 12 square feet. And again, there's some additional costs in setting up that clinic. So not for every community pharmacy, but I'll briefly touch on the highlights of that program as well. So just want to identify the three proper ways to expand your scope of services, because I can assure you there are more wrong ways to do this than right ways. And so we want to help you navigate the correct way. So to start with, let's look at remote care. And if you look at CMS and what they've have the CPT codes that they've accepted, if you go clear back to 2015, the very first CPT code approved by CMS was Chronic Care Management, or CCM. Again, that program was focused really on the physicians offering a chronic care management solution to their patients. Then in 2019, the remote physiological monitoring came onto the scene. And that remote physiological monitoring is a program, again, designed to help physicians provide remote patient monitoring to their own patients. And then if the new kid on the block here, you can see on the far right, is the remote therapeutic monitoring program. So RTM is the program that can now be offered through the community pharmacy. And it is a turnkey solution with Brain Health Plus that Remote Care Today does all of the heavy lifting so that community pharmacies can offer this. Again, there's no cost at all to the pharmacy to start this program, and wanted to give you some of the highlights of that program here today. So if you look at the different conditions that are covered under RTM, most of them are musculoskeletal disorders, but you can also see respiratory issues and also medication management. In the middle column, you see the symptoms that are covered. Very broad symptoms: pain, stiffness, weakness, swelling. It's pretty easy to qualify a patient based on the symptoms. And then the outcomes, it's addressing a lot of concerns that seniors have, but the two top concerns are loss of memory and loss of balance. And this addresses that and much more. So, why is Medicare really pushing this program? It's because they're literally spending billions, with a B, in addressing falls today. And they anticipate that that's going to double in the next 5 years. So this is a very important to Medicare and CMS to come up with programs that could help prevent that. One of the scary statistics here is that patients with dementia are 300% more likely to have a fall. And that is true. I was just talking to a pharmacy in North Carolina a couple of weeks ago, and his own brother-in-law has dementia really bad and had a bad fall, and unfortunately had to have a hip replacement. Well, the poor guy has had 2 or 3 more falls since then, because he forgot that he had the hip replacement and that he needs to use his walker to get up and move around. And unfortunately, he's trying to just stand up and walk without any assistance, and has fallen again a couple more times, which is really sad. A senior falls every second of every day now. And on the cognitive side, seniors in their 70s and 80s, 2/3 of them are experiencing some kind of cognitive decline. And Alzheimer's is on an all-time high, with someone being diagnosed about every minute now. The programs that are being built through Remote Care Today to help these community pharmacies help their patients in the community have been clinically proven to delay or even prevent dementia. And we're seeing also reversal of muscle atrophy with this program. So it's an amazing opportunity for you. And I've got a short 2-minute explainer video about the program, Brain Health Plus. This can explain the program better than I can. So let me just play this demo for you.
As an independent pharmacist, you already know your patients count on you. And with reimbursement challenges and tight margins, finding new revenue streams that actually help your patients is more important than ever. That's why we're happy to introduce you to Brain Health Plus, a remote therapeutic monitoring program, RTM, covered by Medicare Part B and most Medicare Advantage plans, designed to improve memory, balance, and cognitive function in just 5 to 10 minutes a day. It does this with fun exercises and games that stimulate the brain, increasing neuroplasticity. Your patients can access Brain Health Plus from their smartphone, tablet, or computer. It's a one of a kind RTM platform that offers engaging, fun, and clinically proven activities to improve cognitive health, prevent falls, and helps your senior patients stay independent longer. We're talking about daily brain games, interactive motion sensing exercises, motivational health content, medication management tools like being able to scan your medicines right into the system, reminders of when to take medicines, potential drug to drug interactions, and even geofencing alerts so loved ones are notified if a patient visits the ER or hospital. Every patient also gets a 30-second biometric facial scan they can do at home so they can scan their face and track their health as often as they wish. This amazing technology lets them track important health vitals like blood pressure, heart rate, and oxygen levels with 96% accuracy. Done with a smartphone or even a computer, it keeps patients motivated and engaged without replacing their medical care. And here's the best part, we do it all for you. You get a fully turnkey solution, flyers, posters, bag stuffers, and patient onboarding handled entirely by us. We even do all the Medicare billing. No added staff time, no upfront cost. In fact, no cost to you ever. Just real results for your patients, such as a clinically proven decrease in falls and better memory. And you can earn administrative service fees for simply reviewing monthly patient progress reports for each participating patient, which will significantly add additional profits to your bottom line. Brain Health Plus, easy for you, powerful for your patients, and great for your pharmacy. Click the book a call button to schedule a demo and bring it to your pharmacy today.
So as you can see, very comprehensive program, as was brought out in the demo. It is covered by Medicare Part B. Don't stress, community pharmacies. You don't have to be in network with Part B because remote care today is, and all of their providers that will be managing the care plans are in network with Part B. Also covered by most Advantage plans, but every patient will actually do a insurance verification when they do their onboarding, and they'll know exactly what is covered and what isn't. Approximately 80 to 85% of the patients won't even have a copay because they'll either be dual enrolled or they'll have a supplement plan. But for that 15% or 20% of the patients that do have a copay, they'll know that up front and they'll know what that small amount is, and then they can proceed. So no surprises. They'll be able to know up front. I do want to share one testimonial with you. This is one of my favorites from Paul because he's 89 and he doesn't like to exercise. He admits that he hates to exercise, but he'll do this program. Now, Ludafit is just one of the tools on the Brain Health Plus platform. It's a really fun one that kind of gamifies the exercises. And so, like I said, he won't exercise, but he'll do Ludafit, which is exercising. So I want to share this little testimonial with you.
My name is Paul Charney. I live in Tucson, Arizona. I just turned 89 years old, and I hate to exercise. When I had the opportunity to try Ludafit, I found it fun. I enjoy it. I enjoy it because it's a game, and psychologically, I know that it's benefiting me. You move, and the avatar, that is a figure that represents you on the screen, it moves along with you. And it's fun. You hear the shushing of the skis through the snow, and you see obstacles in front of you. You try to avoid the obstacles. And my very favorite, even though it's probably the most strenuous, is the Thai rock climb. What you're doing is climbing up a mountain path, and not only are you sidestepping, but along the path, there are rope ladders. And in order to climb a ladder, you reach your arms up and you just keep moving. My kids saw me exercising, and they wanted to try it. And they were laughing, and it comes with a lot of giggles anyway. Initially, when I first started it, I had to hold on to a chair. But I found that repeatedly doing the exercise, I got confidence in letting go of the chair. So right now I do it freestanding. Bottom line, I'm sold on it.
I love his testimonial, especially because he talks about, having to hold on to a chair to stabilize himself when he first started, but now can do it freestanding, and so he's actually getting stronger each day. That particular tool, Ludafit, is the tool that has probably the most clinical studies done on it. A a version of that platform is already being used in over 500 rehabilitation centers nationwide. So it's one of the key tools in remote therapeutic monitoring. Now, Remote Care Today will provide all of the marketing materials and patient education for you, so you don't ever have to spend one dime on any of that. They'll provide all of that, those materials for you. They're even working with a company that makes the prescription bags, and they'll do the printing right on the outside of the bag for you as well. You'll set up a landing page for you. So it's like your own website that you just simply direct patients to that landing page to get additional information, hear testimonials like Paul's and many others, and then all the information that's needed for them to enroll. Also, it's a good idea to have whoever the face of your pharmacy do a little welcome video. And so, if that's you or if that's a tech, have them do a little welcome video. Remote Care Today will actually script it out for you and tell you exactly what you need to say. But that way, when patients come to your landing page, they see a familiar face there. So, what Remote Care Today needs your assistance with is a administrative service fee, and they will pay you for that. So this is an opportunity not only for you to help your patients um, with their balance and with their memory, but you'll also be able to get compensated for doing a administrative service, reviewing each month the progress of each patient that's on. So this 30-second video shows you what your responsibility is.
Working with our program is easy for you and your staff. If you choose to review your patient's monthly progress and earn administrative services fees, you will be sent a weekly email notification reminding you to log into your portal and review patient assessments. You or an appropriate member of your staff will review these reports, review the summary data for the patient, add your notes, and then simply click the sign-off box next to the record. It's that easy, and it's that fast.
So it really is that easy. In the example here on the right-hand side, you'll see that 100 patients at $25 per patient is approximately what the pharmacy is receiving on a monthly basis. So that's a residual month over month for every patient that's on the platform. So with this 100 patients, it shouldn't take you more than 2 hours worth of work doing the administrative service fee, and you're being compensated, $2,500. So 200 patients, is 5,000 extra to the pharmacy. So a really unique program that will help community pharmacies help their senior patient population in a way you've never been able to help them before, and get compensated through the administrative service fee. Now, step two, if you want more information about how to get set up to do the Independent Pharmacy Provider Network, which is the fastest growing community health collaboration in the country today, with, I believe they're in close to 20 states now, a couple hundred pharmacies that are participating, about 5,000 physicians that are participating. Why are so many physicians participating? Because this program helps them fill care gaps that they're missing, and they need your community pharmacy to be a place of service. So this really is a win-win-win. The patients win because they have easier, faster access to care by going to your community pharmacy than waiting around for a month or whatever, however long it's going to take them to get in to see their primary care provider. But the primary care providers still win because they're still managing the care plan for the patient, and they're getting compensated for that. This is also filling those care gaps that I was talking about, which improves their quality measurement scores, which then allow them to get higher reimbursements at the physician side. But for the community pharmacy, they're the biggest winner in this scenario because approximately 67% of the bill charges stay with you at the community pharmacy because you're the place of service. So It's a tremendous opportunity that will turn things like vaccinations into a instead of it just being a $20 or $40 reimbursement from your PBM, it can become over an $80 reimbursement as a preventative health visit. Here's just some of the examples of some of the CPT codes. The continuous glucose monitoring at the top, the CGM program. And those are the codes, the 95249 through 9524 or 251. Those are all of the tests setting up your patients to do continuous glucose monitors. Well, today pharmacies are doing all that service, helping them set up their monitor, show them how to get their data. You're doing that out of the kindness of your heart. Well, under the IPPN program, you get compensated for that. In fact, it's anywhere between $50 to $150 per patient per month. Also, you can see the 99391 through 99397 codes are all of the preventative health codes. So again, this is turning services that you might already be doing or any consultation that you're already doing for free, you're actually going to get compensated for it in the IPPN program. Step 3 was the brick and mortar clinical room. Just quickly highlight this three-legged stool for you. Again, it's not for every pharmacy. You've got to have space for it. But if you do and you want to really expand your scope of services into a full clinical room, the first leg of this stool is the managed services. You own the clinic. You even name it whatever your pharmacy's name. You just add and wellness to your pharmacy name. But it's kind of like Intel inside. So Brim Wellness is the Intel inside. It's the managed services and the setup of your clinic. The second leg of the stool is the talent exchange. Think about it like this: it's like Uber, but for medical staff. So it's no need for you to have a nurse practitioner or a nurse on staff unless you need them there. So you would stack up your appointments on one day and then post the shift, and then a nurse or a nurse practitioner or medical assistant would come in and fill that shift based on what needs you might have that day. The third leg of the stool is what I'm most excited about. That is the financial vehicle. So it's the pharmacy fund. You can borrow from the fund to build out your clinic. And then when you pay back the fund, you become a cooperative member of that fund. So not only are you helping the next community pharmacy set up their clinic, you're now earning interest on the money generated in that fund. So someday you'll hopefully be retiring and you'll be handing your pharmacy down to the next generation of community pharmacists. And this pharmacy fund could be a part of your retirement for you when that day comes. So I do appreciate everyone coming this afternoon to hear about all of the services that go well beyond just dispensing medications. Just to recap, on the clinical side, the remote therapeutic monitoring, absolutely no cost to your pharmacy to set that up. There are some implementation fees for step 2 and step 3. Those are separate demos that we can get you in contact with those companies directly. And then please remember the ServeRx program. We're here to help you get the fair reimbursements you deserve. And you're probably already contracted. If you're not, we can do an independent agreement for your pharmacy. Pretty straightforward. Get the BAA in place and help you get those higher reimbursements. We're 100% out of network with PBMs, and we'll never funnel your patients off to mail order, which is what the PBMs do. If the PBMs see that you have a claimant that's going to have multiple refills, they're going to automatically send them a letter making it sound like they've got to get their refills at that PBM's mail order pharmacy. We will keep that patient coming back to your pharmacy to get the refills. So if you're not using ServeRx, we hope that you will get enrolled with us right away. We're here to help. But thank you, everybody, for joining this afternoon, taking time to hear more about the mini community pharmacy more profit roundtable. My name is Breck Rice, and I absolutely love community pharmacies and will do everything I can to help you be successful. Thanks, everybody.